Today I will tell you about Dr. Zarev and his secret. I have crossed the entire globe to meet Dr. Zarev. Let's just say this is the first thing I will show and tell you concerning Dr. Zarev. It is difficult at times to balance on a non-entertainment channel telling you important things and trying to make it interesting at the same time. Please don't forget to subscribe to the channel and write in the comments hair transplant or Dr. Zarev. Let this be payment for my efforts. Well, about the secret of Dr. Zarev. Let's go! So the topic of Dr. Zarev's talk is my approach to the donor and recipient areas in gigasessions. That's what he calls his large graft transplants. I can say that indeed many clinics in the world already consider transplants of more than 3,000 to 4,000 grafts as megasessions. I want to note right away that Dr. Zarev does not speak English very well, so some of the words from his report are read off the paper and not always understandable. Nevertheless, I will try to reconstruct everything for you. Gigasessions are not applicable in hair transplantation in any case, only when the donor area really allows to extract the necessary amount of donor material and detailed planning. Here, Dr. Zarev shows the results of his patients on whom gigasessions have been applied. These are transplants of 10, 11, and 14,000 grafts. Not follicles, but grafts. Be careful when someone under the guise of grafts promises you 10,000 follicles, because 10,000 follicles can be in 3 and 5,000 grafts. The only difference is that grafts are counted, follicles are counted quite rarely and more often in world-class clinics. This is definitely not a story about Russia or rented offices in Turkey with transplants for 2,000 euros. I have to say for myself, the doctor himself does not share his secret. Whereas the whole world chases his secret while he gets outstanding results. This is the level of the world's doctor to look up to. It is definitely not necessary to be guided by charlatans, which are at least 80% in Turkey, not to mention the CIS countries, which are not even as good as Turkey yet. Once again, due to the fact that the doctor does not speak much English, the report was recorded in advance and presented as an audio file. First, donor area analysis. Those are the areas that are not affected by DHT. It is also important to analyze the quality of the follicles themselves. Second, segregation of the donor area for zones with different density. It is very important to segregate zones with low and high density of follicles. Third, determining the direction and angle of hair growth. Next, the microcamera examines all areas according to the following parameters. It is density of hair, number of follicles in a graft, quality and diameter of hair, and the most interesting, % of follicles in catagen and telogen phases, color contrast of hair and scalp and even the surface of the scalp. Whoever watches my videos closely on the main channel, remember I talked about epidermal quality. In fact, sometimes the quality of the transplant also depends on the quality of the recipient area. So, how's that for planning? I know of only a few clinics that do this sort of thing. Note that even renowned doctors such as Kore Erdogan also observe with interest the practice of, might say, the newcomer Dr. Zarev. Now let's look at a specific case. A seemingly hopelessly bald head. The entire donor area was estimated at 350 square centimeters and 24,800 grafts, of which 45% were to be extracted and transplanted. And that's 11,160 grafts. This is what the head looks like before the first hair transplant. This is after the first hair transplant on day 11 and 7,450 grafts. This is what the donor area looks like on day 10 after the second hair transplant with 3,710 grafts. Have I seen similar results before? You won't believe it, but yes, just a few days ago, and it's not Dr. Zarev. What does that tell you? That such results are indeed achievable. Why, then, do we talk about Dr. Zarev specifically? Marketing. I would say this talented doctor just stormed onto YouTube and presented himself correctly. You wonder what other clinics are doing this and cheaper? That's what my detailed paid consultations are about. You help me learn the material, I help you get the best results. Is it fair? It seems fair to me. 7 months after the second surgery with a total of 11,160 grafts transplanted. Is it possible to transplant that many grafts? Why, then, is the donor area not as spotted by graft withdrawal? This is the secret that other doctors around the world are chasing. Do doctors have any guesses as to how he does it? I, for example, have, maybe just because I am not a doctor, but I am technically savvy and can observe it all not only from outside the medical field, but also from inside. In fact, similar technology is used in other areas, not medical, I'll tell you right away. And because of that, maybe doctors go around their own offices and don't pay attention to what technology is used in other areas, until someone, like Dr. Zarev, declares it to the world. And immediately with perfect results. Be sure to watch the end of the video. Next, a case is shown that is even more complicated, where 60% of the follicular capacity is used. The first transplant was 7,270 grafts, the second 3,920, the third transplant 1,700 grafts, total of 12,890 grafts. Is it really possible to do this in clinics? I'd rather tell you for whom such results are not possible. It's for those clinics that focus on flow. It is more profitable for them to do 20 surgeries with the help of assistants than to go through each case in detail. And, of course, the flow of clients is more profitable for the portfolio, too. Try to understand when in one day the clinic gets 20 bald heads, even if only 5 hair transplants are successful and 15 unsuccessful. That's 5 photos a day just for the portfolio. For example, at the Smile Hair Clinic I was at, in the huge contract, between the lines, so you don't notice it is written that all your photos can be used for the portfolio. And you sign off on that. Pretty tricky, isn't it? And the point is, that more often than not, it's the kind of clinics you find yourself in, that is, factory clinics, where they grind up money. There's just no way to concentrate on the results. So always read the contract. Contact me and I will suggest you a clinic and a doctor specifically for your case. Well, let's move on. For whom is it possible to achieve such results? For those who do 1 or 2 operations a day, 3 at the most. For those who can spend a lot of time on planning and math, which is very important. Then there's only one snag. How do you make the donor area look good and not show signs of graft removal? And here's the secret. In vacuum extraction of grafts is something else. Watch the video to the end. Next, the case is seemingly utopian, 70% with a donor area of only 240 square centimeters and 14,020 grafts transplanted. The next thing Dr. Zarev does is define the following parameters. The first is the general boundaries of the recipient area. The second is that the main follicle atrophy zone is marked in pink. Then comes the division into subzones with different degrees of hair follicle atrophy. After that comes the math calculations for each of the zones. And then taking into consideration the natural direction of hair growth. The second success factor is the mathematics of calculations. Let me explain. On the left is the data column of the donor area, from which the grafts will be extracted. The natural density of this client is 84 grafts per square centimeter. Looking at the follicular component of each graft, we have 257 hairs per square centimeter with an average of 3.1 follicles per graft bundle. This patient has a hair density of 85 microns, which is actually good hair. For information from my consultations, in seldom, your hair tends to be thinner. Then we look at the hair regression phase rate. In this case, it's 7%. And we multiply this figure by the average number of hair per square centimeter and we get a density index of 20.3. That's the analysis and the math for the donor area. Again, let me remind you that this applies to a particular head where the hair is dense and the average is 3.1 hairs per graft. As a rule, our hair, European hair, Slavic hair is much thinner and more often with a lower graft bundle value. More often all famous doctors take those patients where you can get excellent results for this very reason. And not every big-name doctor will want to take your head or will take it, but just for a larger amount of money. Back to the counts and then the recipient area, where the patient still has his hair and where the new grafts need to be transplanted. The density index of this area is 7.9. I call it remaining hair density index. In this case, the doctor decides to use 60% of the donor material, from which we get the density index of the donor area 20.3, multiplied by 60%, the total index is 12.2. I would call this index the donor area withdrawal index. Next, I would call this index the zone adjustment index. Here, we don't just calculate how much hair can be transplanted, but we calculate the index, in which both the donor and recipient zones will be of the same density. That is, we align the overall pattern of hair, which is why I called it zone adjustment index. Total, 12.2 is the withdrawal index from the donor area. We deduct the remaining hair density index of 7.9 to get 4.3. I'll call it the effective hair transplant index. As a percentage, it's 21.3%. Taking into account the number of follicles per square centimeter in the donor area, we have the need for transplantation of 51 hairs per square centimeter. Since the average number of follicles in a graft is 3.1, we get the required density for an additional 18 grafts of hair per square centimeter. And now a message to those clinics that laughed at me a year and a half ago when I accompanied my clients to surgeries and drew frontal lines in broken style. A lot of clinics said at the time that you can't do that, we don't do that. That's the thing, you don't, and those who do get extraordinary results and very natural front lines. Now with clinics that know me, of course, it's easier for me to negotiate when I prepare a customized front line for you. I model it on the computer, specifically for you, and that's one of my unique services. And now clinics are already listening, as a year later you can see the impact of my opinion and my front lines that I draw for you, but that's for those who use my services. Thank you for your trust. Next, Dr. Zarev is asked, neatly approaching the main one. After what interval can you have repeat hair transplants? He answers, 10 months. Dr. Zarev is then asked about the areas he calls unsafe and not very important. And the second question about the pouch is what is used to extract the grafts. They ask him, you can't extract such a huge number of grafts with a medium punch, it has to be a very small punch. Do you increase the size of the punch? To the first, not the most important question, he answers that, in principle, he uses this material from the middle areas as well, which I also, by the way, sometimes recommend using, depending on each case. When asked about the punch, he answers that he uses different diameters, depending on the zone. The minimum diameter is 0.45 millimeters and the maximum is 0.7 millimeters. From myself and my own observations, I would like to say that clinics usually use a minimum of 0.78 millimeters. The smaller the punch, the less noticeable the white dots in the future, but also the more difficult and longer the hair transplant. The doctor is asked several times about the punch. He gradually evades. The doctors neatly want to know some things that will tell them what Dr. Zarev's secret is. So the Indian doctor asks about the vacuum pump.
Vacuum assisted technique. I use motorized device and vacuum inside the punch. So he uses.
Dr. Zarev says, yes, I use a vacuum, and quickly goes back to the punch, putting the emphasis exactly on the punch. Such a, psychological trick, I use a mechanized extractor. You get it. I mean, he didn't lie, and he didn't keep his mouth shut, but he quickly covered it up with other topics.
Small question to Bruno. Bruno, do you record your consultations, like video all the consultations that you do? Do you record them?
In fact, Dr. Zarev is not hiding the fact that he uses vacuum technology. What, then, is the main sticking point of other doctors in understanding the process and this magic that Dr. Zarev is doing? First point, the absence of a blood mark. Second point, after surgery, the donor area looks nearly untouched. Well, with the second point, in principle, it is possible to use a small punch. The tiny punch solves all of these issues, that is, it's a more delicate job working with a tiny punch. But still the question remains, how do you make an incision to get this very graft out with a vacuum? What I can personally assume, the fact that Dr. Zarev uses PRP plasma not after the hair transplant, but before the hair transplant. How, perhaps, would I do it myself? One does the PRP plasma, then simply makes holes with a tiny punch, but doesn't extract it. So we make incisions, we leave the graft there. And after a period of time, when the internal bleeding is complete, we already extract all the grafts using vacuum technology. In this way we avoid external bleeding. Maybe so. He is further asked, what are some of the major challenges that can arise in these gigasessions?
Usually I don't have complication, but it's complication like
That's a great doctor. Everything is as it is. Then the question, how long does the surgery last? Usually it's more than 1 day and you need at least 2 surgeries in 10 months. Sometimes you need 3 surgeries, for example, if you need to transplant 7,000 grafts in 2 days. We transplant in 6 hours a day, 1 hour extraction and 4 hours implantation. The next day, it's exactly the same again, and then 10 months later, we operate again. It's interesting here, too, because he goes on to say that it usually takes him 1.5 to 2 hours to extract 1,000 grafts.
Depends. Sometimes happen for 1 hour, but depends on the patient.
It all depends on the individual case. I've told you this many times and still don't stop writing in the comments, even demanding to provide a single pill, a single clinic that will work for everyone. Usually these clients end up at exactly the fast food Teggery clinics or at some academies with fake doctors who are willing to say what the clients want to hear.
Okay guys, we have to finish, we have to move on to the next session. Dr. Lupanzolo, please, and congratulations.
Remember, I try to make your hair transplants quality by gathering information from around the world. Don't forget to subscribe to the channel and please write hair transplant or Dr. Zarev in the comments. Well, and most importantly, have great hair. Bye.